Ordering the right test at the right time is crucial to providing evidence-based patient care to achieve the highest quality outcomes. It can also help increase financial sustainability for a hospital. Both of these objectives can be accomplished through a successful laboratory stewardship initiative. PeaceHealth understands this quite well. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hederle with AHA Communications. Join us to hear insights from PeaceHealth about their experience establishing a lab stewardship initiative that improve patient care and outcomes through optimized testing, all while driving down costs for enhanced financial sustainability. Today's podcast is brought to you by the College of American Pathologists.
Good day. I'm Elisa Arispaguachaga, Vice President of Clinical Affairs and Workforce at the American Hospital Association. And today it's my pleasure to have Dr. Ghofrani, System Medical Director for Laboratory Services with PeaceHealth Southwest Medical Center, joining me. Dr. Ghofrani, I'm really looking forward to talking with you a little bit about laboratory stewardship and the work that you've been able to do at PeaceHealth. Can you walk us through a little bit, particularly for those who may not be that familiar, some of the goals of lab stewardship and the impact and role it has in patient care?
Sure. Thanks, Elisa. So laboratory stewardship, in summary, is optimal utilization of laboratory testing in the interests of best patient care. So there are two sides to this. One is making sure that we're not overutilizing tests that might not be the best tests that are available, or not overutilizing tests in an inordinate frequency. The other side of it is making sure that we are not underutilizing tests that could be helpful to the patient and would be the best tests in that particular scenario. And this is all in the interest of driving the best patient outcomes and best patient treatments.
Absolutely. And I think certainly as folks understand the value of some of these tests, can you talk a little bit about some of the benefits? And I'm thinking from three real lenses. One, benefits to providers as they are providing care. You talked a little bit about the benefit already to patients of making sure they're not overly or under tested for important things, and the benefits to the hospital.
Sure. In terms of the benefits to providers, so as we all know, clinical laboratory medicine is a very rapidly advancing field. So there are always new tests coming to the market, replacing older tests. And so I think one of the benefits of laboratory stewardship is that the lab can serve as a resource for these providers to tell them and inform them on what the best tests are available at the moment. And so the clinical decision support that is provided by the lab to the providers is one benefit that can go to them. And in terms of the patients, as you alluded, the benefit is that the patients don't get unnecessary testing. Because as you know, testing is what drives a lot of the treatments. So if the patients are not getting unnecessarily tested, then they're probably not going to get unnecessarily treated by the same token. And for hospitals and health systems, the benefits are reduced waste. We're not wasting the hospital and the health system's resources on tests that are not necessarily helpful to the patients. And it will also lead to downstream benefits, for example, decreasing length of stay and reducing costs.
Absolutely. And I think especially that support for providers as things change so quickly has got to be really key. In that vein, what were some of the key elements your team focused on to really gain support for the program, sort of starting with that support to providers, but also across the hospital and health system to really get this work underway and get the buy-in you needed to move forward?
Sure, that's a great question. So, I think one of the main areas that we really focused on to get the program started was securing support from our executive leaders in our health system. They had the name recognition and the respect in our health system. So with their support, we were able to launch the laboratory stewardship program, which up until that time was not even recognized, or not even, nobody knew about it. So when we had that sponsorship from the executive leaders, that really helped us move forward. And it was also very helpful in recruiting a wide variety of stakeholders to be participating in our laboratory stewardship program. Because even though the name is laboratory stewardship, but we are basically making recommendations for a wide variety of providers, and it has a wide variety of impacts, for example, on our IT system, in terms of finances. So in our laboratory stewardship committee, we try to have a very diverse representation. So we have, besides our executive sponsors and laboratory leadership, we have specialists from IT and informatics. We have people from finance. Obviously, we have clinical subject matter experts and a few CMOs, chief medical officers in our health system. And having that wide variety of representation, besides being able to contribute to the robustness of the discussions that we have at our monthly meetings, it also helps us to gather champions for different projects that we're embarking on in different specialties and different fields that we're discussing. So I think that's one of the main points, is having a very wide and diverse representation on the committee. And also, one of the first things that we did in developing the Laboratory Stewardship Committee was developing a charter. So in the charter, we basically defined what are the things that we are going to be tackling, what is our role. We are not a decision-making body, we make recommendations. And so the decision-making happens at higher levels of leadership. But the fact that we recognize what our scope is, that helps us to stay focused on the conversations and not run into scope.
That sounds really like a great start, really getting everybody on board and helping bring all of that expertise to the table. Can you just tell me a little bit about the program itself and sort of what the day-to-day structure looks like? You have your committee that meets and supports this work, but what is the broader impact it has?
Sure. So, I mean, typically the process for any lab stewardship project that we have is, it first starts when somebody brings up a question or brings up an issue to us and say, well, this is a problem that I am seeing in my day-to-day work. Now, this could be somebody from the laboratory. It could be someone from infectious disease, for example, seeing that, for example, this test that is being used in our health system is not the appropriate test and we should be using something else. And so that's when it starts. And after that initial project is brought to our attention, then there's the data collection. So we want to see what is the current practice, what are the practice patterns that are common among our providers right now. And if there's any particular areas that we need to focus on, that becomes evident in our first data evaluation. So once we have that data of what the current practice is, and we look into the literature and guidelines that exist, for example, the Choosing Wisely guidelines, and to see what the best practices are. So in other words, we're in this current situation, what is the ideal state that we want to move to? And once we have those discussions, then the question is, okay, so how can we get there? These might be a variety of interventions. Education could be the first and simplest way to do this, but oftentimes education alone is not enough. So we might have to make some IT interventions. So for example, reordering the order of tests listed on a test menu in the computer system, or basically eliminating some options. And finally, pop-up windows, which provide just-in-time clinical decision support. Those are some of the methods that we've used in our interventions to trying to provide support to our providers. And basically, with this process, once we've implemented an intervention and we've sought approval from the stakeholders and from leadership, then we wait a few months when the intervention has been implemented, and then we gather follow-up data to see if we have been able to make that change that we were hoping for.
That's great. I love that you make it as easy as possible to do the right thing, whether it's reordering or even just, helping people not click on
Right.
the thing that you've, really researched and determined is not the right thing. So can you tell me a little bit about some of the changes you've seen across PeaceHealth since implementing this program? Both, the expected kinds of changes that you just talked about in terms of we had a specific project and we aimed to go here, but also, if there were some unintended or, surprises along the way.
Yeah, so this was definitely a learning process for us. So, for example, initially one of the tests that we decided was not helpful to be used, we decided to eliminate that test. And so we thought that we had communicated this adequately. We had discussed this in different provider groups, but it turns out that when we actually wanted to eliminate the test, that's when there were some objections to it. So I think one learning is that we need to communicate changes like this widely and far ahead in advance and plan for it so that there are no surprises. And at least if we can't get stakeholder input from everybody, at least give as far ahead notice as possible so that people have an opportunity to express their concerns, make recommendations. Maybe if they think there are alternative solutions that could be useful, they could have a chance to bring them forward. So I think that's one of the most important learnings for us has been to always focus on getting stakeholder input and giving everyone adequate time to think about the changes and comment on the changes as much as possible. Obviously, not everyone is going to agree, but the fact that we're giving enough opportunity to have a rational conversation, I think, is very important. I think one other learning that we gained is to make sure that when you start a program like this, you might not have many projects at the beginning, but soon as the committee and the stewardship program is recognized in your hospital, in your healthcare system, people will get interested and start bringing proposals to the committee. So it's really good to have a program manager, someone at least to be able to keep track of different projects, where they are, because many of these are going to be months-long projects. They're not going to be something that can be decided upon in a week or implemented in a week or so. So these are going to be long-term projects, and we need somebody to be able to keep track of these, follow up on these, and at least set up the agenda for the meetings that are going to be happening every time so that nothing is missed. And because you don't want a proposal that has been brought to the committee and has been agreed upon to fall through the cracks and be ignored or forgotten after a while.
So overall, what's been sort of the sense at PeaceHealth about this? It sounds like it's been positive, but what are some of the reactions you've gotten from the different clinical, business, and administrative realms?
Well, I think, as you said, it's been really positive. I mean, by the fact that with our follow-up data gathering, we've been able to show that we have reduced waste, we have increased savings, and in terms of, I think the most important is the quality of care that we are providing to our patients. When we can show with data that there has been a definite improvement in patient care, that's something that makes everyone happy, and everyone appreciates the efforts that we have been doing in our lab stewardship committee. And just after a couple of years, I'm really happy to say that it's a respected group in our health system right now. Our recommendations are really taken to heart because they know that we have taken all stakeholder inputs as much as possible, and the decisions we make and the recommendations we make are well thought out, and we've tried to look at all aspects of the question as much as possible.
Great. You mentioned a couple of key elements around communication, around making sure you have that longitudinal program manager to keep all of these trains running and make sure that the program continues to move forward. If you could go back a couple of years ago and tell yourself, hey, you know what, this is a great idea. Let's do this lab stewardship program, but don't forget or don't miss this opportunity, this person to involve, this type of approach. Is there something that you wish, you had done early on that maybe it took you a while to figure out?
I think maybe as time went on, we discovered that, for example, some leaders that we invited to participate in the committee, they might not have had enough time to participate because they were so busy with other leadership activities that they had in the healthcare system. So it was great to have their name in the roster of our committee, but they wouldn't have the time to actually participate. So we would have to recruit others in their place. So maybe I think one we might do differently is that when you're recruiting for the lab stewardship program, make sure that they will have time to devote time to this initiative. That way you can make most efficient use of the meeting time because everyone is going to be around the table and we can all discuss the issues.
That's good advice. Anything I didn't ask you about your program that you feel folks should know about getting a lab stewardship program up and running?
One of the aspects of laboratory stewardship that is often promoted is that it will lead to savings. And I'm not denying that. That is obviously a benefit of a laboratory stewardship program, but it's not the main objective. I think it's important to emphasize that the main objective of a laboratory stewardship program is to make sure that the quality of laboratory testing and as a result, the quality of patient care is as optimal as possible. Now, savings are going to be accrued by such a program, but that's just a byproduct. What our focus is always going to be is improving patient care and improving the quality of laboratory testing.
Absolutely. As one of the parts of the hospital that touches literally every patient, the more that you can help improve the quality and really address some of these challenges, I think it's just such a boon to the organization. Well, Dr. Gofrani, thank you so much for joining me today and sharing your insights. And for those listening in, if you'd like to learn more about the College of American Pathologists, please visit info.cap.org/healthcare executives. That's info.cap.org/healthcare executives. Thanks so much.